Enhancing Services for Homeless Populations program through JCIPE. This is an all virtual program that's held within the virtual world of Second Life. And we've operated the program for about 5 years now. And I just did a report on participants, and I think we've had something like 35 participants or so, or similar to in the program in that period of time. So it's not a huge program, but it's one that students find helpful in learning strategies for working with people experiencing homelessness. So that's really the main purpose of it.
That's great. So Susan, I was supposed to introduce you, but if you don't mind, if you can say a little bit about
I'm
yourself.
Sorry. I thought maybe that had already taken place. Given my sorry about that.
No, that's okay. But I would love for you to speak a little bit about your background before you start.
Sure. Absolutely. Absolutely. Yes.
Us as well. That'll be nice. Thank you.
Yes. So I'm Susan Toth-Cohen, and I'm the director of the Post-Professional Occupational Therapy program at Jefferson in the Department of Occupational Therapy. I'm also the faculty lead for virtual programs, meaning that I do a lot of work with training interprofessional teams to work with underserved populations. So we have the Enhancing Service for Homeless Populations, ESHP, that we'll be talking about measurement in that today, and also the Alzheimer's Virtual Interprofessional Program, or AVIT, that we have piloted now with both students and staff at a community organization. Yeah, and I think that's what I wanted to convey. And then Dr. Haas, I wondered if you could go ahead and introduce yourself.
Yeah, sure. I'm Rick. My full name is Richard, but everyone calls me Rick. I have 2 jobs now, like Susan. So I am first the Director of Assessment, Evaluation, and Research for JCIPE, for the Jefferson Center of Interprofessional Practice and Education. And so in that capacity, I sort of direct and consult on the evaluation and assessment of mainly student outcomes, but other outcomes as well from all of our programs. We have 6 and growing now. And also sort of, you'll see today, sort of also try to push our research into directions that I think it should be going. And that's what we're going to report on today, is sort of in the process of evaluating the ESHP curriculum. We kind of hit on a measurement tool that probably needs some revision and some revalidation. And my second hat is in the College of Population Health, where I just assumed the program director position for the PhD in Population Health Sciences program. And so there's a really nice natural sort of link between the work that I'm doing on both sides, which is really fun for me. So we were both super psyched to be able to talk to y'all today. And yeah, what we're going to report on is really sort of critique of this tool from what we saw, and then our plan for a study that we are about to begin, and then just a little bit about sort of the why, if anyone is familiar with both confirmatory and exploratory factor analysis, why the confirmatory approach, if you can do it, works out a little bit better in a practical setting. And so we'll run that whole gamut. So I am in control. Susan, should we get going?
Advance.
Okay,
yes.
Sure.
Yes. So our learning objectives for today are to discuss planning of a new exploratory confirmatory study of the structure of the original 35 HPATHI items. These are our goals for you to be able to do, that you'll be able to discuss that, and also to discuss the choice of exploratory and confirmatory factor analysis methods, how these choices will aid in the clarity of validation evidence. Next. So the enhancing services for homeless populations, and this is the same for other big virtual programs. I shouldn't say big because they don't involve huge numbers of students, but our other main virtual program the AVIT, they have 3 phases: preparation, simulation, and debriefing. So in preparatory phase, students review a number of materials, and one of the most important of these is case biographies of each case. I'll talk a little bit more about the cases as we move on. Published articles that help them, students, to identify what typical roles might be, what kinds of issues the person may be experiencing, and then videos of people similar to those portrayed in the cases that they're role playing. Then they go on to the simulation, and they work as teams in groups of 3 or 4, where they have at least one provider, someone enacting the client or homeless individual, and an observer. And so since there are 3 different cases for the program, they have a chance to each enact a major role, which gives them a multifaceted experience of being able to understand what it's like to be a patient or client who's experiencing homelessness, to try out the role of provider. And it's a very new role for them a lot of the time, but gives them some experience and a taste of what it's like without risk, because it's a safe environment for both the person who is enacting the role, but also if you consider the vulnerability of the population, then it's not exactly super easy to have programs with the person experiencing homelessness directly. Then an important part of it, which is a characteristic of all the JCIPE programs, is debriefing. That's also characteristic of most any simulation, where they discuss their experiences from the perspectives of the provider, client, and observer. Next, please. And here are the cases. We have Jeff. They are addicted to heroin and have dual diagnosis of schizophrenia and substance use issues. Leon, who is an Iraq war veteran, couch surfs, has type 2 diabetes, has a very severe foot ulcer presently. And then Christina, who left an abusive relationship and has taken up in a new home, transitional housing, just arrived there. Jeff, just to add to the context, Jeff is living on the street and has set up a home for himself as a tent outside an abandoned factory. Leon couch surfs with friends and others. And key issues are engagement, collaboration, and resources. And I think the next part is, going on from there, what we have done in the ESHP program is we have had a composite measure that has combined knowledge of homelessness, and we drew that from an organization that addresses issues in homelessness, the Move for Hunger organization. We also obtained questions from work by Asgary, who is a faculty and physician working in the New York City area with homeless populations. And then of interest, especially for this presentation, is the health professions' attitudes toward homeless inventory, which is the HPATHI. And then we also used within this composite scale some questions from the attitudes toward homelessness inventory, another measure. Okay, Rick, now we're on your part. Are you all seeing this panel with people's photos? I'm trying to move it out of the way. I don't know.
Is it on mine? Is that better?
We're not seeing it, so.
Oh, good. Okay, good. Oh, I don't have to worry about it at all. Excellent. I love that. Must be a function of my smaller laptop. Great. Okay.
So I did want to show everyone sort of what we had been doing that was working. So what Susan referred to are knowledge questions. We found that they actually are at least difficult enough to show some change. Whereas sort of on the self-efficacy measures and this is a subscale from the ATHI, societal cause. So it's sort of items, it's 3 items that have to do with basically like homelessness is, a function of policy and stuff like that, right? Which is contrasted with another subscale within that full survey. But we had kind of picked and chosen some items from these different questionnaires, and what we noticed was that at least the content of the HPATHI sort of represented things that weren't on here, but that really gelled well with some of the outcomes from the program. So the main outcomes that we track at JCIPE have to do with interprofessional collaboration, which we have another measure for. But I think it's super crucial in this program to be able to actually look at the impact on attitudes, even though some folks like to push further than that. We adopt the Kirkpatrick Bar levels of assessment at JCIPE so that attitudes are at least important. And I think if we take a look at this tool, you'll likely agree. So what is it, right? Buck and colleagues was the paper that reported the initial overall validation of the tool, which really meant for them, and we'll see in a minute, that they talked about how the items were developed a little bit, and that was published in a separate paper. And they talked about sort of an initial study where they trimmed some items, and I want to focus a little bit on that and why they did that. And then the items that sort of passed that were put into an exploratory factor analysis led to a 19 item, and I meant to put Likert type survey. So there are 5 answer choices from strongly agree to strongly disagree, with neutral in the middle. And it's designed to assess the attitudes, interest, and confidence. Those are the 3 factors or latent variables that they felt were represented by these 19 items. And the purpose was to be able to measure that in medical students and other healthcare professionals. The main purpose was for educational programs. So it's a nice fit to HPATHI, but I think it would be a good fit in other areas. I mean, I think with any health science, sort of post-professional program or even undergraduate program with some sort of module attached to homelessness, it could be a really good tool. And as I said, the content of the items we felt most closely matched the ESHP learning objectives that were not having to do with interprofessional collaboration. In this paper, in the Buck paper, they did use the ATHI to look at convergent validity to sort of make sure, well, okay, ATHI measures attitudes towards homeless individuals. That's what it stands for. This new, 2005 was new, HPATHI measures attitudes of health professionals towards homeless individuals. They should correlate, right? But if you look at the content of ATHI, it sort of focuses more on political and social issues rather than sort of how the person feels about a homeless individual when they're working with that individual. So that's why and it's also older, and I think was initially developed in England. So what I wanted to talk to you all about today, what we wanted to kind of get feedback on is, this is sort of a very common way to start to do survey validation, which is you'll see a paper that sort of talks about a lot of different things. If the space in the journal is big enough and they do it well, it's a nice way to lay out a lot of different pieces of evidence for validity of the tool. So their 3 phases that they reported were item development via the Delphi technique, although the details of that seem to be left to another publication. Then a second study where they piloted the 35 items that made it out of the Delphi process with a total of 72 third-year medical students. And they looked at Cronbach's alpha and test-retest reliability for those 35 items as a total score. And then from there, and the details in the paper a little bit shallow, and that's part of what I wanted to bring up, they reduced it down to 19 items and then factor analyzed that and found, or at least concluded, that there were 3 underlying latent variables or factors that were being measured by these items, and they gave them the names that we'll see in just a little bit. So we both, Susan and I, were discussing, sort of found a lot of issues in this paper that felt like could be revisited to make a better tool. So the first and most sort of biggest problem is that the tool is called HPATHI, Health Professions Attitudes Towards Homeless Individuals. And the intent is to make it relevant for use in lots of different health professions. But only medical students served as the sample or population, sorry, that were sampled for phase 2. And actually we'll see phase 3 was only in medicine as well. So that's a big problem because you need to be able to have your sample be representative of anything you do with psychometric analysis is particular to that population and what you've sampled from. So if you move to a different population, you have to revalidate the tool. You have to look at more evidence, see if the same structure holds. The sort of strange thing that they did here is they elected in this sample to do the item pruning. So they report that 12 items were discarded due to, quote, high correlation with other items, or that had low correlations with other items. So there's a couple of problems with this. One is that they sort of assume that there's a unidimensional model. They assumed that when doing this, one assumes implicitly that there is one thing and one thing only that each of these items measure. And so they're sort of saying, well, we had these items that overlapped with each other, so we should take them out. And then there's ones that didn't correlate with the total scale, so we should take them out, right? They don't produce any data on what those correlations were. And I mean, there's nothing necessarily inherently wrong with this. It's just that it's not really standard practice. This is one reason why you would use an exploratory factor analysis, because it allows you to do this item pruning without the assumption of a structure, without the assumption that there's one and only one a variable underlying all of the items. So I wanted to take a look. These are this is the full 35, and everything with an X next to it was discarded. So some of them are sort of, you could see that, so providing medical care for the homeless is futile, is sort of a rephrasing of a couple of the other items, like homeless people have the right to basic health care. However, you could think about sort of this being somewhat different. Obviously, they would be opposite, right? So if it's strongly disagree to strongly agree, one would think that if you endorsed, say, agree or strongly agree to this item, then you might sort of not agree with this item. So you could see how there would be some overlap. All people have a right to basic health care is similar to homeless people have a right to basic health care. So that makes some sense to knock that off if they felt it was being too redundant. There are some sort of tricky ones, like most homeless people tend to be drug addicts or alcoholics. That's a little bit double-barreled. So you could see how some of these, that would be okay. The question is, why didn't, if they had responses to all of them, why didn't they put all 35 into the factor analysis? And the easy answer is they didn't have enough participants, right? So with 72 participants, you've got 35 items. The rule of thumb with factor analysis is you want about, 5 to 20 even more people per item, right? And the main reason for that is just to have the estimates of the factor loadings be a little bit more, while you're estimating, really what you're estimating first is the sample correlation matrix. So like a higher sample size, that sample estimation is going to be a little bit more consistent with the population estimate. So larger sample size is going to be better. And there's a lot going on in exploratory factor analysis. So that was kind of puzzling, but fine. Phase 3, again, they use medical students and then also some other professionals, that those professionals happen to be residents and other medical professionals. So there's no nurses, there's no physical therapists, there's no occupational therapists, there's no pharmacists, nothing in the sample. It's 160 medical students and doctors, professionals, right? They also do something which is tricky, because if any of you know anything about doing factor analysis in SPSS, the computer program, the default in that program is actually principal components analysis, which is not factor analysis. It's a different data reduction technique. So but there's also something called principal axis factoring. So it's not, they described that they did this, but then they talked about a rotation, which does not apply to principal components analysis. So it makes me think that they did use a good factoring method. So principal axis factoring with the Promax rotation is going to allow the factors to be correlated, and principal axis factoring is a little bit better when you have items that might not be super normally distributed. They also mentioned in passing that they actually used 23 items in this sample, but then did the factor analysis a couple of times and went down to 19. So that's also, you don't usually do that. You just show that the factor loadings are low for these items, and that's your result. They also use something that's very common, which is for each item to compute what Cronbach's alpha would be if you were to delete that item from the tool. The idea being is if you delete an item and alpha goes down, then maybe that item is important for reliability. This is actually a very misleading procedure. And so there's been a lot in psychometrics in the last 10, 15 years about sort of what different reliability estimation techniques actually are doing for you. So I'm going to talk about why this isn't so great. From a really basic perspective, if we look at the factor solution, we see a lot of cross-loading. So this is the final solution that they went with, that they explored in their paper. And so they named factor 1 personal advocacy. So the items that ended up going there are, I understand that my patient's priorities may be more important than following medical advice. Doctors should address the physical and social problems of homelessness. I entered medicine because I want to help those in need. I'm interested in working with the underserved. I enjoy blah, 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 right? Personal advocacy, many of the content of these items, many of them seems to reflect this idea that this professional went in hoping to be an advocate for homeless individuals at the personal level. If we look up here, we see homeless people are victims of circumstance. They have the right to basic medical care. Homelessness is a major problem in our society. And you also have, strangely, sort of, I feel comfortable being a part of a team who will provide care to the homeless, which doesn't sort of gel too much with social advocacy, but the other ones seem to go pretty well there. Cynicism is just what it sounds like. So if we look at these two items, it's like, I think one of them is reverse scored. So I feel comfortable providing care to different minority and cultural groups. I feel overwhelmed by the complexity of problems that homeless persons have. So that one is kind of odd. Oh, and also homeless people choose to be homeless. So we have these two, feel overwhelmed, choose to be homeless, but then you have the I feel comfortable, which possibly they may have reverse scored the other ones. It's not exactly clear, right? So I look at this solution and I see a lot of problems. If you know factor analysis, if you don't, so I'm not sure how many people aren't familiar, but what we're looking for here is what's called simple structure. You can think of factor loadings as like almost like a correlation between this item and this unseen thing that it's supposed to measure. And so what you want to see in a factor solution is you want to see a number that's like greater than 0.3, preferably 0.6, 0.7, 0.8, 0.9 in one of the columns, and you want the other columns to have numbers close to 0, right? So that's what's called simple structure. So this first item is pretty well behaved. Homeless people are victims of circumstance. This loads pretty heavily on social advocacy, and the other two doesn't seem to measure that, right? Same thing here. Homeless people have the right to basic medical care. So all's well for these first 3 items, not super strong cross-loading. When we start to get down here, homeless people are lazy. It loads on social advocacy and cynicism. And again, exploratory factor analysis is full of rules of thumb, right? Because it's an exploratory method. It's really hard to make substantive conclusions from an exploratory factor model, mainly because these numbers will change depending upon the sample, and even if you rerun the analysis, they can change slightly because factor analysis is not going to yield a unique solution, exploratory factor analysis. In order to do that, you have to put constraints on the model, and that's when we move from exploratory, which we see here, to the confirmatory approach, which is more about fitting a model and testing a hypothesis that that model fits. Right? From a practical perspective, the presence of cross-loading suggests that, for example, this homeless people are lazy item, that this item is influenced by 2 things, right? More than one thing. Now, the reason that we don't want that is because what we want to do with a multi-dimensional tool like this is we want to single out these subscales that seem to be unidimensional. But you can't argue that an item that has these 2 loadings is unidimensional. So first of all, you have to ask the question, well, which subscale is it part of, right? And then the second is when I put this item along with the other one. So let's constrain our thoughts just to these 2 items for a minute. So people, again, give answers from 1 to 5 on both of them. If I want to put together a sum score or an average score for each person of these 2 items, this one also has a little bit of a cross-loading. It's less than 0.3, but it's still there, right? So when I'm using these items, I have no idea whether they actually measure either of these things and to what extent they do. So that's not good. That's not great. Especially if we have an outclick, let's say we've put a program together where we want to reduce cynicism in health professionals. Well, we don't have a good measurement of that. We have a measurement of that that's a little cloudy, that's confounded with another one. So what you want to try for in exploratory factor analysis is to look for those items with simple structure, and then you would prune the items that don't have it. So if I was doing this analysis, I would argue maybe these 2 items need to go, or it could be that there's too many factors here. It could be that there's really only 2 factors, personal advocacy and social advocacy, and that the cynicism factor is kind of just noise. So that question is a question that one can do when you move on to the confirmatory approach. So this, to me, sort of begged okay, well, first of all, this is a paper from 2005. Did anyone else attempt to confirm this solution? And the answer seems to be no, that about 60 or 70 papers cite this one, and they're mainly papers, looking at educational programs designed at health professionals. So it's a lot of, I've seen, papers that have used this inventory that say, oh, it's, nursing program institutes an intervention to help teach folks about caring for homeless individuals, right? So researchers are using this tool outside of where it was validated, and potentially using it in a way, these subscales that don't seem to make a whole lot of sense statistically. So how do we improve? Unfortunately, and now I'm guilty of this myself, I've published analyses that are simply exploratory, but I try to make that statement clear that when one engages in exploratory factor analysis, what you're trying to do is generate a hypothesis, and that hypothesis is that this tool has this number of latent variables behind it, right? And then you can, so you put that, that's the interpretation that you get from exploratory factor analysis. Confirmatory then is you get a different sample and you fit the common factor model, but you do so in a way that puts constraints. So for example, in the EFA table, what you're seeing is a 3-factor model, confirmatory model, but you're allowing all of the items to load on all 3 variables. Going from exploratory to confirmatory means that, right, you'd say, okay, well, these 3 items are only related to social advocacy directly, and they have 0 loadings on these other ones. So you put in these constraints, and those constraints give you degrees of freedom to allow you to test the fit of the model. So you can actually perform a hypothesis test. So I think the item structure, tackling that is a good idea. The best approach, and this is tough, right? Because samples don't grow on trees. We have to go out and recruit people to be in studies, and I get it. This is the convenient sample that they had at hand. If you can, though, if one can plan a larger study, the easiest thing to do is to just get as big a sample as you can and split it randomly into the part of the sample that's going to be, that the exploratory factor analysis is going to be done on, and the part of the sample that you're going to use for confirmatory. Again, the EFA 5 to 20, there's no rhyme or reason for this. Like I said, it's just sort of like better, more is better. But this is a way you can plan a study. All right. What is really even more important, like I said, for this tool is it's only been validated with medical students. So we really have no idea how the structure might change if other health professionals were included in the sample. So what we plan to do is we think it would be appropriate if we could get a large enough sample to go back to the original 35 items and administer them to a large sample. We're hoping for 500 to 600 participants among the health profession students at Jefferson. It's a big hope. If it's smaller, what one could do is you don't have to split the sample 50-50. Generally, you need more larger sample size for EFA than CFA. You can get away with a confirmatory factor analysis of, say, 200 people, because in this case, we know we're probably going to delete items based on the EFA. We know that there's items that probably won't fit. So, we could allocate 60%. So let's say we only get 400. We could allocate 60% of participants to the EFA and 40% to the CFA. And again, you strive for that simple structure. You want to try to get high loadings in one and only one column, on one and only one factor. And then any items that don't have that simple structure or have no loadings greater than 30 on anything, those are discarded. And the other thing I think is important, which kind of gets lost on some folks, is you also want to try, and this isn't as easy to do, but you want to sort of strive for subscales with 3 or more items, because it's very hard to assess reliability of subscales with fewer than 3 items. You can do it, it's just a little bit harder. And also, if you're going to fit a confirmatory model, depending upon how many factors there are, sometimes you have to have 3 or more items per factor. So the last thing I want to talk about is sort of quickly why alpha ends up being not so great sometimes. It's pretty good. And this is also a reason why one should go for the exploratory confirmatory approach if they can, because you basically get information that you want altogether for free, right? Coefficient alpha or Krabbeck's alpha makes an assumption about the items in a subscale or a test. It assumes what's called tau equivalence or true score equivalence. And what that basically means is that it assumes that all of the items on a scale, so we would assume that, okay, all of the HPATHI items on personal advocacy have the same factor loadings and the same inter-item correlations and true scores, meaning their scores on the factor. It's a very restrictive model. And so there's a lot of hubbub about the fact that this is almost never true in the situations in which we use alpha. So why do we use it? Well, because it can give us a good estimate of alpha sometimes. If our scale is well behaved, if the factor loadings are all pretty strong, then it's not so bad. There's another way to assess reliability that comes out of the confirmatory model, which is really nice. So the confirmatory or the common factor model that's used in confirmatory factor analysis in test theory is called the model of congeneric tests, which is just a relaxation of the assumption of tau equivalence to just to allowing a subscale or a single unidimensional sum score to have different factor loadings and different inter-item correlations, but do end up having the same true score. So if we look at personal advocacy, when you run coefficient alpha, you're making the assumption that your model, which is, let's say, 5 items, okay, influenced by this latent variable, that all these factor loadings are the same. Right? Now, that's clearly not true here, right? Although one could argue these are pretty close, right? They're not too bad. If we tested that formally, it might not work out for us. The model of congeneric tests, which is essentially the regular old common factor model from confirmatory factor analysis, allows each factor loading to vary. From that, we can compute 2 different types of reliability. What's called composite reliability, or omega, right, is a definition of reliability, right, which is basically the reliability, the variance of the common factor divided by the variance of the sum of the scale of the item scores, which is another way of saying the variance of true scores divided by the variance reliability being the proportion of variance in your subscale score that's attributable to your true score on a latent variable can be super easily computed using the factor loadings and these unique variances or the uniqueness terms, right? And these are things that come very easily right out of all statistical packages. Alpha varies or differs from this on the order of the latent variables. So this is one way to define alpha using really the covariance matrix of the items. And so alpha is kind of like the average covariance amongst items. And so if it's high, then that means the items all covary together pretty well. And so the sum of them, right, together is going to give you a good approximation of that true latent variable. So who cares? Right? The reason that this matters is because a lot of folks believe that when you use coefficient alpha, that you're testing whether that subscale or set of items is homogeneous, is unidimensional. That is not true. That is an assumption of coefficient alpha. Coefficient alpha makes the assumption that this picture is correct, right? So you're not testing this picture with alpha, you're simply just using this picture as a motivation. So being able to run a study, whenever you do confirmatory modeling after an exploratory factor analysis, doing it with the model of congeneric tests and using omega actually ends up usually giving you higher reliability values and it's more accurate. You can depend on it better. Alpha is sort of, we don't ever know, is it really accurate or is it really not accurate? So you get it all for free in the end. And so we see this as a much more robust procedure for really the confirmation of the structure of any survey, but specifically here with HPATHI. So real quick takeaways, always be looking to build on or refine psychometric study methods. It's stuff's all over the place. We've all sort of been taught different things. I'm probably saying things that other folks would disagree with. And so it just means we can, show it's all evidence, right? It's all part of evidence. And of course, in most frameworks, validity and validation never ends. We keep adding evidence, The more robust evidence we have for a factor structure, the better we can compute reliability. And so the more we know how precise our outcomes actually are, right? And so with a program like ESHP, which has tended to be small, we want really precise measurements because our sample size is so small, right? So anyway, we wanted to bring this to you all, and I know we only got a few minutes left for questions and see what you think, and we're just really, really happy that you asked us to come.
It's fantastic. Very interesting topic, and I think you're clearly very knowledgeable and passionate in this area of work. So thank you for bringing your knowledge, but also your questions to us. Thank you. So I would like to open it up for questions and thoughts that people might have. All right, so I'll take the first shot at questions and comments, and then move us further. So I don't know if you've had a chance to meet Jenny Martinez, but Jenny Martinez is also a faculty, and I'm guessing your student as well. So me and Jenny are currently conducting a study where we are also engaged in a factor analysis. And so it was really enlightening to see how SPSS has some drawbacks in the method. So Jenny, we definitely have to go back and kind of revisit our methods based on some of the content that Dr. Haas presented. So thank you for that. So my question is related to the actual items. It seemed based on the progression of how scale development process was done by others in the field, that it could be that one important aspect of the study might be missing, which is cognitive interviewing. So even though they developed the items using a Delphi methodology, what cognitive interviews generally yield is what people are thinking as they're answering these questions. So I read the question, I read the responses, and then I have a whole conversation going on in my head, which when I communicate to the investigator, I can help the investigator understand what's wrong with that item or what's wrong with the response scale. So do you know if cognitive interviews have been done, or what do you think about that being the next step before you venture into your battle between the exploratory versus confirmatory?
I actually think it's a really good idea that I tend to often forget when I get so focused on quant stuff. But yeah, I mean, it's part of Messick's framework, right? And actually might be a good thing for us to do either in parallel or, because I know, yeah, that folks often will drop items that way. So it was interesting that they didn't report doing that. I don't know if I saw any efforts at all in the literature to try to even do that. I know that no one has followed up and tested the structure, but I don't think it's true that anyone even did cognitive interviewing. But yeah, that's something I didn't even think about. Susan, we'll have to update the IRB proposal.
Mm-hmm. We've got time.
Christina, you had a comment.
Thank you I was thinking along those lines, Nimrata, as well. And while I don't have a ton of experience, I do have experience with item development, and it was specific to certain populations. But the other thing, I know one of the limitations you mentioned was that it was really focused on medical students, right? And the professionals that will be working with these individuals span much more than that. And so if you are considering taking a step back with regards to the item development and looking at cognitive interviews, even something like focus groups that include multi or interdisciplinary professionals to really look at the items and get their feedback might also help make it more applicable to multidisciplinary professionals as well. Again, it sounded like, I don't know that research or their process, but having just used, do you know who was included in that Delphi survey when they developed the items?
I think it was just experts. I don't know that I tracked down the other paper. I have the paper right here, but I believe it was just, physician. Oh, so it was physicians and NPs, experts in homeless healthcare recruited through snowball sampling. So there were NPs in there.
Yeah.
But still, that sounds like they sort of went to a practice and sort of got what they could do, got what they could get. Mm-hmm.
And we used a very iterative approach when we developed our items, right? Like we took items from measures that were already existing and out there, and then came together, saw what was applicable. We looked at patient goals. So maybe even interviewing some of the people who are in these settings. And we were constantly refining them as we were doing our cognitive interviews and as we were doing our focus groups, so that by the time by the time we got to the confirmatory factor analysis and the exploratory factor analysis, we already knew that hopefully they would kind of fit on our continuum. And so just if you were taking that step back with regards to item development, focus groups might also be a good way to go.
Yeah.
The other reason I feel like cognitive interviews would be helpful is because you said you have the neutral category, which is always such a trouble category that people just don't want to commit, especially when it comes to social advocacy. And these are sensitive topics that people may not want to commit either way, considering where the political climate is going. And so I think that neutral category might be really interesting to investigate if somebody chooses that one.
Good call.
That's a thought I had.
Yeah, these are things I always sort of, push them over here because it's harder. It's hard work, right? This is important stuff that I think we should do. I don't know, Susan, if, so we're sort of at this, there's this item pool, right? They've sort of given us this 35 item pool. Mm-hmm. So, and one could add or take away, but it almost sounds like there could be a sort of a need to make something else as well. I mean, I don't know what you think about that. Like what this might be missing, the HPATHI, that you would want to see measured.
Well, I think we would be able to determine that from the cognitive interviewing. That isn't that a main purpose of the cognitive interviewing, is to really look at expanding our perspectives on it.
Yeah,
that would be valuable.
Yeah, that, and maybe it'll give you an idea of some new items as well. But I don't know if at this stage you want to invent new items, because it does look like you're building on a really popular and common scale. So, but you might have a bank you might create in the future as a next step.
Right. Yeah.
It's interesting.
Thank you.
I can go on with questions and comments, but I just want to pause for a second if anybody else had a thought. All right, so I'll go to my next question, and I can spend hours on this topic. So this is a lot of fun for me. So then the next question is, in our center, we do a lot of RASH or IRT based measurements. So when you started talking about item fit, that's where I was headed. And I was wondering is factor analysis more important than an item fit analysis using one of the IRT methods? Because it does look like you have some evidence to have subscales, and your confirmatory factor analysis can confirm if those subscales are unidimensional. But is there room at this stage that you're already thinking about item fit and you might want to investigate that? So I was wondering what your thoughts were.
Yeah, I think, my experience is much in psychology, where I came from. The factor analytic model is so much more popular, I think, because of the, wanting to get the structure and everything. But now there's been so many advances, and of course, so many papers sort of showing, well, and the two books that we can share these slides. There's two books, one by McDonald, the other by Rakoff and Markolides, that show clearly what you probably all know, that the two are just different parameterizations of one another. But yeah, I mean, I think once you've sort of gotten the structure correct, that yeah, you want to start looking at differential item functioning and item fit, and then thinking about scaling it in a different way. And that's something I don't do as much of. It's something I've started to do with some of our knowledge items, because that's super important. And, binary items, I think, are important for that. But yeah, I think that's definitely a good next step for anyone to do, because those methods, it's so funny how for a long time they sort of were developed this way. And now with advances in statistical computing, and somebody asked about a preferred stat program, it's really, there's nothing wrong with SPSS. There's a default in SPSS that's confusing. But SPSS actually is really good for exploratory factor analysis. It can't do confirmatory. For confirmatory, you've got to use one of many. I use R for like everything because it's so, you can do everything. And it's free. I did just get M+, which I'm very excited about because it can do both IRT and common factor stuff, which is really cool in one program. But they all do the same thing. it's just with SPSS, it's so hard to figure out exactly what it's doing. And then once you do that, you're like, oh, okay, it's using this computational method. The reason I like R and M+, and I think SAS is probably this way, is that they're a little bit more documented in terms of the back end to know what you're actually getting. Some of the labels of things in SPSS are antiquated or old, or misleading, but it's an excellent program for exploratory factor analysis. It actually does much more than R does. You could probably only do better than SPSS for factor analysis with M+, I would think.
Thank you. I'm vigilant of our time, and I would just like to thank both of you for being here and participating and sharing your knowledge with us. So thank you, and please come again.
Thank you.
Thank you.
It's our pleasure.
Thank you. And thank you for these ideas. This is like we have a whole other study. So it's very exciting.
I'm excited about that cognitive testing.
Kind of.
All right. Thank you, everyone.
Thank you.
Thank you.
Bye-bye.
Bye.